employees. This is the first thing that is to be written in your answer. Of course, you mentioned that. So the literal meaning of vicarious is felt or experienced by watching or reading about somebody else doing something rather than by doing it yourself. That is, without ourselves doing, you enjoy or experience uh, that same feeling as what the person is reading or doing something. And it is called vicarious. In doing so, the theory of respondent superior is used in malpractice lawsuit. The term literally translates let the master answer, which you also mentioned. In other words, an employer of such a person is held responsible for the negligence of an employee, such as the doctor. A number of requirements must be met for the respondent superior to apply. The employee committed negligence during the defined work hours. That should have been the first and foremost criteria. And occurred during an activity or task the employee was hired and paid to perform. So he is, for example, if an anesthetist commits a negligent mistake, he is not observing the patient properly, he gives a spinal and goes out, sits in the dressing room, and patient goes into hypotension and has a problem. That means he has not performed his duty during the defined working hours, and he is paid to look after the patient after giving anesthesia, and he has not been doing that. So that will be again the responsibility of the management. And the activity during which negligence was committed also benefited the hospital in some way. So by giving anesthesia, he is helping the hospital to collect the money for the operation as well as the anesthesia, everything. But he is on a regular payroll. So the hospital is also getting benefited by that. And when applying vicarious liability malpractice last two, what is the first thing to establish is an employer-employee relationship. A full-time employees work only during a particular working hours. A hospital also has a right to control over a full-time employee. So they can take action on them, they can punish them, they can suspend them, they can even dismiss them. All this control is there for the hospital over a full-time employee. In the context of medical law, right of control entails right to define the method a doctor may use to admit, evaluate, and treat a patient also. And when a hospital has the right of, as an employer, it may be held liable for the negligence of a doctor. Where this right exists, vicarious liability may be ordered to establish. When does vicarious liability apply? A hospital may be held liable for the following forms of negligence or errors committed by an employee if he is a full-time employee and there is a right to control for the hospital. These two things are important. And what are all the mistakes or negligence the person can commit? He can make a misdiagnosis. He can wrongly diagnose or administer wrong or untimely medication, or withhold or not administer a medication which is required at all. So that is also administering a wrong medication or not giving the right medication at the right time is also a negligence. And surgical errors and mistakes or anesthesia errors also come under this particular negligence. Careless monitoring of the patient, failure to follow up with the patient, all these things come under negligence which are liable for vicarious liability on the hospital or the controlling authorities. And vicarious liability for doctors, a doctor is responsible for supervising and overseeing a team of other healthcare employees such as nurses and technicians. So in the theater, if you have a nurse technician or an anesthetic nurse, and you ask them to administer the drugs and maintain a case, and you go out, you don't supervise them, and they give a wrong medication and something goes wrong on the patient, even though the mistake has been done by the paramedical or the healthcare employee, the vicarious liability will be on the in charge doctor or the anesthetist. For example, for us to understand, even if you have a technician in the theater, whatever mistake is committed by him, you are responsible for that. That vicarious liability will be there on the doctor only. And if a member of this team commits negligence and does not provide a quality standard of care, the doctor may be held liable. And what are the common defenses to vicarious liability you can apply in the court of law? It is common for an employer to argue that vicarious liability does not apply as the negligent person did not meet the definition of an employee, and if the negligent person was an independent contractor. This particular thing, you should understand that it may be for a visiting consultant. For example, to understand this point, what is an independent contractor? He may not be in a full-time role. He is not a monthly payment role of the hospital, but he may be a visiting consultant. Then he is considered as an independent contractor. And if he does any negligence, it will not affect the hospital. Only those who are on full-time payment and full payroll and who are coming under the employee-employer relationship, they are only liable. Then only the hospital becomes liable for vicarious liability. And the hospital may also argue that doctor or professional who make a mistake was not working within the defined hours or exceed the scope of employment. Then also the vicarious liability will not apply to the hospital. And a locum tenens physician will be an independent contractor. This is what I meant by the visiting consultant. The locum tenens physician, or sometimes, in the Western countries, they have what is called locum physician. That is, a practicing doctor may go on a leave, say for about a month or so, and he can recommend somebody whom he knows for his position to occupy during his absence. Then he becomes what is called a locum consultant, and he becomes an independent contractor. He will not be treated as a full-time employee because he is only a temporary substitute for the full-time employee. So this is an independent individual who is hired solely to provide physician service as a substitute physician for a limited period of time. So it is very important that a locum tenens physician be specifically identified as a non-employee or an independent contractor when seeing patients. Otherwise, the entity or individual who hired the locum tenens may very well be liable for an present of commissions of that physician. So whoever recommends this locum, who is the permanent employee of the hospital, he will bear the vicarious liability and not the hospital directly. So that is the understanding between a locum consultant and a permanent consultant. And there are three final take-home messages. First and foremost, have a professional liability coverage, not only for the physician personnel, but for any nursing and other non-physician personnel in the office. This is important because healthcare liability claims can and do arise from the actions of non-physician and even non-professional personnel. So even a theatre assistant or a ward boy, if he commits any negligent act, then that may also be considered as a negligence and the hospital may be sued. So you must take additional coverage to cover all these faulty actions of these non-physicians and non-professional also. Second thing, make sure that any employee are supervised and any problem employees are immediately terminated and not retained for long. And the third, if locum tenens physicians are ever used, make sure that the patients are directly informed that the doctor present is a substitute and not an employee of the physician or the practice. So that is the third thing whenever you employ somebody as a temporary substitute. And nothing can absolutely prevent a lawsuit. Taking these simple steps, though, can at least reduce the anxiety associated with the claims involving employees and independent contractors and put you in a good position to defend those claims. So these are the 2 points that you have to include in your answers, so that this is a very small question only, very, very small short notes, but it is important that you have to cover all these points so that the answer is complete. Okay?
Sir, just for information, the earlier days when the government doctors had a lawsuit or something like that, the government would employ a lawyer and they would pay the compensation. That is not allowed anymore, sir. Just for information, sir. The individual doctor is responsible, even if you are a government employee.
Yeah, all of you would have recently read.
That is the new thing now. So make sure that just
eye
because you're in
hospital
government
where
service, you're not
it
protected. Yeah.
yeah, it was happened about 10 to 15 years ago, where a child posted for skin surgery fortunately died, and the anesthetist and the operating surgeon and the hospital, all three were booked for negligence. And the consumer court awarded that some amount to be paid by the anesthetist, a part of the amount to be paid by the surgeon, and the rest by the hospital. So the award was given like that. So even though the hospital is directly not involved, that is a part of vicarious liability. Okay.